Good day. Today we're going to touch on the importance of diversity, equity, and inclusion in the mental health care setting. Let me start by asking an easy question. What role does occupational therapy play in promoting equity among mental health care patients? About 1 in 5 U.S. adults lives with mental illness, and according to a comprehensive study by Pro et al., minority groups are vastly underserved when it comes to mental health access and care. In addition, members of various underserved groups who receive mental health care do so at more advanced stages of the illness, requiring a higher level of care for a longer period. That means when it comes to mental health care, underserved groups wait longer to get less care that may take longer and cost more. That's far too many barriers for any person to face. Occupational therapists play an important role in inpatient mental health care. We typically work as part of a comprehensive care team, which also includes psychiatrists, hospitalists, physician practitioners, nurses, caseworkers, social workers, aides, and activity directors. And we work together to provide individual and group therapy to address mental health issues. Of course, we also work with patients to address other issues that they want to work on, such as ADLs, mobility, and other physical conditions. We already know that occupational therapy works to help individuals, regardless of age, gender, race, sexual orientation, level of ability, or mental acuity. We help people because they have some limitation that they want to work to overcome, or find more satisfying ways to live with. We want everyone to participate or engage to the best of their ability and at the level they choose. So how do we break down these barriers that mental health patients face? How can we help this population engage and participate? As Harris and Arbor point out in their article, everyone, including mental health patients, experience wellness and distress differently. We cannot simply apply a one-size-fits-all approach to mental health care. Our approach must be as individual as the patient. Mental health patients have a significantly vast diversity of backgrounds, from homelessness to well-established family members, from destitute to wealthy, employed to disabled, all sexual orientations, ages, nationalities, and a limitless variety of background stories. So as occupational therapists, how do we ensure that we are reaching this population inclusively? We know there is inequity in access to mental health care. Determinants such as insurance access, costs, urban versus rural locations, immigrant status, education level, language barriers, and social stigma can all inhibit access to mental health care. How can we help these patients if we can't get them in the door? And can we make intentional efforts to promote diversity, equity, and inclusion to reach mental health patients and bring them care? Certainly, each one of us can. There are two important ways we can do just that. First, we need to find ways to improve access to mental health care patients across the spectrum. Advocacy and grassroots endeavors can help shape these efforts. Occupational therapists can help shape engagement by seeking presentations, lectures, and educational opportunities that focus on diversity, equity, and inclusion, and their impact on mental health care access. Whatever we can do to shine a light on the topic can help further conversation and action. In addition, we can support this population when we keep the topic top of mind when engaging our own professional activities, committees, and conversations. Be a personal advocate for mental health access by making people aware of the need to reach this population with any business decisions. in department meetings, when meeting with superiors, or even in conversations at the lunch table. Raise the awareness of the need for mental health access for all age groups and ask for suggestions and assistance in bringing these ideas to light. Another effort we can pursue: develop a network of coworkers who are willing to mentor students, particularly underrepresented students, who may be considering a career in the mental health arena. Reach out to schools and provide opportunities for students or potential students. And be available to share insight, answer questions, and develop relationships with key stakeholders. We can also support initiatives to increase the number of mental health professionals with diverse backgrounds. Research has shown that patients respond more positively to health professionals who look like them and share their backgrounds. We can do a great service by diversifying our professional staff to reflect the patients we serve. In addition, we can advocate for research demonstrating the efficacy of early mental health interventions in various settings, including schools, primary care, acute care, and home settings. Finally, we can participate in local, state, and federal policy efforts to make mental health care services more accessible to diverse individuals and families throughout our communities. Secondly, as occupational therapists, we need to provide meaningful services that promote inclusion, diversity, and equity in the mental health care setting where we treat. Being included helps patients feel connected, acknowledged, and appreciated. It becomes our role as treating occupational therapists to develop and maintain that sense of inclusion for all of our patients. As occupational therapists, we need to practice patient-centered care, acknowledge each patient's values, beliefs, and strengths. We need to weigh their experience and understand their outcomes. As practitioners, we need to participate in cultural humility and provide realistic guidance through the lens of what is best for our patients, considering their unique experiences and backgrounds. For example, according to a study by Woods Giscombe et al., Black, Latino, Native American, immigrant, and LGBTQ+ populations are significantly underserved when it comes to mental health care and show an increased likelihood of suicide attempts. They receive less care, usually later in the illness process, making them more at risk for relapse, medication noncompliance, and worse outcomes. When any of these individuals reach the level of inpatient health care, are we considering that they are farther along in the illness process? And if so, do we treat them appropriately? Members of one of these populations may require more intense therapy, individualized care, or care that is in line with their cultural expectations, but always with empathy and compassion. It becomes our responsibility to identify and accept the patient's expectation for care and build interventions that best fulfill their needs. A challenge, yes, but as occupational therapists, we face challenges on an individual basis every day, weighing the information presented to us with each individual honestly and with humility, remaining open to new ideas and approaches, and always remaining client-focused concerning mental health care can help each of us break through some of the barriers that prevent underserved patients from living the fulfilling lives they want and deserve. Please see the references for more information and resources on this topic. Thank you.